Carrie joins us as well as Dr. Batra, and we often talk about skin deep, but this literally affected every element of your life. So, Dr. Batra, what did you find in all the studies you sent? I know you sent biopsy for pathology. What did you find, and is there hope?
I have great news, which is that this is treatable and that we're going to work with you on this. So that's pretty good. So interestingly, what the biopsies showed was that actually you have an underlying more allergic dry skin rash called eczema or atopic dermatitis. And then because that disrupts the barrier of the skin and it's recurrently inflamed and irritated, secondary bacteria gets in and causes these infections over and over. And I think you had been told you had acne and you've been given some very drying and very irritating medications for this, and that actually can make this much worse. When you already have eczema and atopic dermatitis, anything that's going to trigger that dryness and that allergies is actually only going to perpetuate the inflammation. And I think the other aspect is that because you were doing this regimen and you were putting alcohol and you were trying to clean the spots out, when you already have eczema and atopic dermatitis, that can actually make it worse. It can irritate the skin further and slow down the healing. And also, I think it made it very difficult to diagnose because by the time you saw doctors and they would just do a superficial swab, those cultures would come back negative. And I think that's why everybody was sort of confused as to what was going on. And when we did the tissue culture and we actually looked under the microscope, there was bacteria there, but it was deeper, and that's why the swabs kept missing it. And that was what I think was fueling the inflammation and keeping the redness and the scarring going. So we're going to be talking about a really hypoallergenic regimen where we give you a prescription strength cream that helps seal that barrier function back, giving you much safer anti-inflammatories. And I think part of the reason, being on these recurrent rounds of prednisone, it does help, but that's not safe, and we can't continue you on that. We'd much rather go the route of withdrawing whatever the allergy or whatever the triggers are. And I suspect a few years ago when this all started, you probably had an allergic reaction to something that became infected, and then every so often it just keeps coming back, and that's why there are these multiple rounds. So I do think that allergy testing and withdrawing whatever those triggers are will be very helpful as well.
And Dr. Batra, how's the future look?
So the future is optimistic. It's bright. I mean, this can be fixed.
And you expect these to heal?
I do. Yeah. So it's going to be a process. We're going to really have to work with you over weeks and possibly months to really eradicate the infection and allow the skin to seal again. But yes, then these should heal up.
So Carrie, how are you feeling? I know you've seen 9 doctors. This is your 10th and your best. Doctor, there's none better than Dr. Batra.
It's been a whirlwind of emotions, to say the least, and even getting ready today when we were doing makeup and hair, it's very difficult to look at myself when I used to have such perfect skin to look like this, and this is such a blessing. This show it's so great, so I'm just very excited that she found out what it was, how to treat it, and I'm ready for my life back. I really am.